Hi, everyone. It's Dr. Sadaf, and I'm so excited to let you know about a free webinar I am hosting on August 25th at 7 p.m. Eastern Time. It is going to be on menopause for men. Yes, you heard that right. Menopause for men. How a man or a partner can support their partner during midlife. So really important information. I get a lot of questions asked to me by people coming in and saying that, they're learning about menopause, but their husbands don't know and they don't know how to support them. And they just feel like they're being, angry and irritable on purpose, which of course, maybe that's part of the thing, but not really. But they would like some information that their husbands could learn from. And so I am doing this webinar just for your partners. And of course, you're welcome to join in and listen in if you find it to be valuable. It's going to be valuable. It's going to have a lot of good information. But the key thing that I'm going to focus on is how your partner can support you in midlife. So remember, it's going to be August 25th, 7 p.m. Eastern. I'll have the link in the show notes for you to register, but also it'll be on my social media. My social media handle is at Dr. Sadaf OBGYN on both Instagram and TikTok. And on YouTube, it's the Muslim Sex Podcast and Fembe Health. So make sure you look out for all of those registrations and make sure you register for August 25th, 7 p.m. Menopause for Men. And see you there. I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Hi, everyone. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodi, and this episode is everything you need to know about gynecology, intimacy, sexual health, agency, and all that great stuff. Before I get into it, the first thing I want to make very clear is, of course, this is not meant to be any type of medical advice. If you have any questions about your health, please speak with your healthcare provider. And if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is a Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I'm very excited to have on with me another OBGYN, Dr. Mary Ojo-Carons. Dr. Carons, you come to us from Virginia. So I'd love for you to introduce yourself to the viewers and the listeners out there that may not know who you are.
Thank you, Dr. Sadaf. I'm so excited to be with you today. And these conversations are so important to have, especially in communities where we don't talk about it. So I'm Dr. Mary Ojo-Carons. I'm in Virginia Beach, Virginia. I am founder of Climax Aesthetic Surgery, where we deal with sex all day, every day, for both men and women. And so this is a topic that leads and has an impact in all aspects of our life. And so that's why I talk about it. And that's why I'm excited to talk about it with you.
Yeah, absolutely. I think that, we don't pay as much attention to it. A lot of people kind of, brush off their sexual health as if, it's not a big part of their life. But I think that, I feel that sexual health is really a barometer of a relationship. And you can really tell, where your relationship is heading when you ask about a person's sexual history and their relationship with their partner, because I really feel like whatever is going on inside of the bedroom is also going on outside of the bedroom.
Mm-hmm. Mm-hmm. I think you're right. I mean, oftentimes when there are challenges in a relationship, an intimate relationship that is sexual, sex is the first thing to go. And so you're right. How close you are to your partner can be exampled in how close you are physically to your partner, how attracted are you to your partner. So it's important to have that connection. It's important to feed that connection because there's not going to be a time always in your life, especially as we get older, that we're going to want to necessarily have sex with our partners, or we're going to have the desire to just be the sexual beings that we are. And I think that's colored a lot more, even in those circumstances where unfortunately people have had sexual trauma, or sex has been abused in their lives. Those individuals still deserve to have healthy sex lives.
Yeah.
And it's a little bit more complicated for them There's a little bit more navigation that needs to be done. But at the same time, we are created to be sexually involved with others. And so if you have had a trauma, if you've had sexual abuse, it is something that will set you back, but it doesn't mean that you don't deserve to have sex. It doesn't mean that you don't need to have sex.
Absolutely, 100%. And I love the fact that you bring that up because so often people that have been traumatized or abused in the past, they carry that with them throughout their whole lives, right?
Mhm,
So there's a lot of work that needs to be done. There's a lot of personal work that has to be done with a sex therapist or maybe even a sex coach, somebody that can help them move forward, but still at the same time honoring their past and the lived experience that they've had.
mhm, mhm.
I'm curious to know what you think, why it's still so hard for women, especially women of color, to talk about sex, pleasure, even basic anatomy.
Well, I think it's hard because for many cultures, and I will say, the African culture, the Black American culture, sex has been linked with promiscuity.
Mm.
Sex has been linked with the negativity, the negative side of um, uh, many negative connotations, especially promiscuity. And so it's hard to have that conversation because we're taught that our own pleasure doesn't matter because our own pleasure means that we are selfish. And I think that's a big part of many women's upbringing. You don't want to be seen as someone who is untrustworthy. You don't want to be seen as someone who is dirty. You don't want to be seen as someone with all these like negative words. And sex is linked with that, unfortunately. Um, and I think oftentimes sex gives us power, gives us agency over self, especially when we are having sex and we are taking control of the sexual situation. We're taking control of how we receive our pleasure. We're taking control of our bodies. And so having that control as a woman, if you just look like along the history of mankind, anytime a woman has control, there is some level of fear, um, and and I think that all of that kind of historical content has compounded into where we are today. We don't even really know it. We don't even think it, but it does have play a role in how sex is taught to young girls. For example, right? We teach our young girls to, when they're sitting down, make sure they close their legs, make sure they sit straight, make sure they're not showing anything below, right? With our boys, we don't have those conversations with them about how to properly sit down. Boys are able to sit with their legs wide open. Boys are able to straddle. And so that's something very small, but I've always thought of why do we do that? Why do girls have to sit prim and proper? And I think again, it's coming back to that level of control.
Yeah.
Um, so, in the Black and Brown community, in minority communities, and communities in this country that have immigrated to this country, we as women are oftentimes taught not to shine. And so, what that's sex is going to play a big role, a big part of that.
Yeah, you're definitely right. I wonder so about how much of that has to do with colonialism, right? And I wonder
Mm-hmm.
like how much of that has to do with puritanical rule. We
Mm-hmm.
know that for Southeast Asians, at least, before we were ruled by the British. Islam is a very sex positive religion, and women are really like men are supposed to help women experience pleasure in their relationship, and in their marriages. And actually, not experiencing pleasure in your marriage is actually a grounds for divorce. So
Mm-hmm.
for women. And so I just wonder, but everything changed for at least what I can, see for Muslims at least was after colonialism. We had this puritanical rule. We had this, where sex was all of a sudden now it was seen as, dirty, shameful, wrong. And so then we, took on those same values. And that's how we started to see sex as something that was shameful, dirty, and wrong. And I honestly feel that for some people who don't know that history, I didn't know that history for I mean, I literally learned that history, my own history, like 4 years ago. So for those individuals that didn't grow up with that history, sex has always been shameful and taboo and, stigmatized. You
Yeah.
don't talk about it. You don't talk about it with your family. You don't talk about it with your sisters, siblings, anyone, because, it's something that's very private. And so I think a lot of women end up suffering, in silence when they have some type of sexual dysfunction because they're not able to talk about it with anyone.
Well, and if I love how you brought up the Puritans, right? Because I think that is very separate from Christianity. And when you're reading the Bible, there's a lot of intimacy and love throughout the Bible. When you're reading about individuals in the Bible who were married, there you see a discussion about sex. They were with one another, and it's not hidden there. I mean, the words are right there. But when we're having conversations, in church, we're not necessarily focusing on that. I've always believed that sex is a gift.
Yeah.
That is a gift from God to us, and it's not just meant for procreation. It's meant for um, to have the capacity to enjoy oneself, to have pleasure, and to give pleasure to the person that you love. Why would you not want to give something great to the person that you love? But at the same time, you're right. It's been villainized, and it's not. I don't want to talk about the abuse side of sex, 'cause I think that's a little bit different. I think what we're
Yeah.
talking about
Absolutely.
is how sex has been villainized and has been shamed. And yeah, that the history in that really is rooted. I do not want to say in Christianity, but oftentimes in the organization
Right.
of religion, and we can say, from my point, the church, the Christian church. And it's harmed us. It's harmed us. And so if you look at cultures, and you're saying the Muslim culture, right? If you look at cultures outside of whatever just religious context that culture is in, so culture between people, not culture from necessarily a religious belief, look at who is prominent in society and who is cared for in those societies, who is able to hold some level of leadership. And let's just start in the home. Who's able to have a voice in the home and who is able to help the home, the individuals, the family in that home navigate? Who is the leader in that home? In my culture, in the Nigerian culture, and again, outside of just any religion, you see that the woman is in control. And so I think that, just like you're saying, plays a big role in how the woman is also in control of herself and in control of her sexual satisfaction, and control of the relationship, or being able to at least be on the same level if she's with a male as her male partner. And so it's a topic that, like I was saying earlier, sex impacts all aspects of our life. And so for we women, if we are not honest with ourselves, honest with ourselves sexually, that will impact our physical health, our mental health, our emotional health. And let's just talk about our gynecological health. Those women that have more agency over their bodies, those women that have more knowledge of their bodies, of how they feel, how their vagina is functioning, how their reproductive organs are functioning, that physically and emotionally feel it. Those women are oftentimes more sexually satisfied because they are honest, and I think that if we're really going to help ourselves as women gain more agency and more control of our bodies, of the knowledge of our bodies, how our bodies function. If we're going to be healthier, then we have to allow ourselves to kind of demystify what sex means to us. And we have to let that happen for our young girls. There are times in a girl and a boy's life where you can have conversations that are age appropriate. I don't think necessarily that you have to wait till a girl starts to menstruate to really have conversations about what sex and what sex is. And so when you're having those conversations, you're also educating her on self, and you're giving her agency over self. And then as she grows, she will demand that she is taken care of in the political world and the world as a whole. So I think, yeah, a lot of it does start with religion. Historically, a lot of it did start with beliefs being imparted on other cultures and seeping in, and that culture losing some of their individual identity. And we've allowed it to perpetuate.
Yeah. Yeah, absolutely. So what do most of the women that come to your practice, what is it that, what are some of the common issues that they've been, let's say, too embarrassed to talk about elsewhere because your whole practice focuses on sexual health? So
Yeah.
what are the most common things that women come to you for?
So, so I always say we deal with the physical. I deal with anatomy and I deal with hormones. But the most important part of a person's ability to have libido and be sexual really is overall well-being. It really is their mental health. So the funny thing is, although many of my women are coming in with menopausal vasomotor symptoms, so vasomotors, hot flashes, night sweats, things like that, and pain with sex that is caused by vaginal dryness, atrophy, genitourinary syndrome of menopause. That's a long name.
It is
Although
something.
those are the most common. What we are most commonly talking about is self-esteem. What we are most commonly talking about is agency over self, honesty with self, being seen in their relationship, being understood in their relationship. What we are oftentimes most commonly talking about is showing up for self. So there is, yes, this physical that we deal with. So again, vasomotor and pain with sex due to vaginal dryness. Those are the two most common physical concerns. But every conversation I have with a patient, new patient especially, it always leads into the other. And so they're interconnected. There is that mind body. You have to have certain medications, certain procedures you may need to deal with the physical complaint, but the physical complaint won't necessarily lead to an outcome where you're experiencing more pleasure until the other side is dealt with.
Yeah, absolutely. We know that the brain is the biggest sexual organ. And, if that's not aligned with what your physical body is saying, you're really not going to want intimacy, right? And we
Mhm,
have something called arousal concordance and arousal non-concordance, meaning that, your body physiologically could be aroused, but if your brain is not into whatever it is that you're
mhm,
doing, then really you don't want that physical act, right?
mhm,
And so that happens sometimes when somebody may have been abused or maybe, or raped or something like that. Their physiologically, their body was responding to that touch or whatever was happening. But, intellectually, like in their brain, they didn't want what was happening. So,
mhm,
we call that arousal non-concordant. So I agree with you. The brain is the biggest sexual organ. And when things aren't aligned, we're not going to want sex, right? And I think also that happens when we're talking about, like, there's an author, her name is Emily Nagoski, and she always talks about, to want sex is to have sex worth wanting, right? So if
mhm,
you're not experiencing pleasure in that relationship, you're not going to want it. And so much of midlife, I feel like, there's so many things that are changing, right? Midlife, anywhere from like 40 to 65 or whatever, so many things are changing, right? We have our hormones that are going up and down. We have, us transitioning into menopause if we're lucky enough to live that long. And, it's just getting used to that, right? Seeing your body for what it is and not, waiting to lose those 10 extra pounds to love yourself, right? So there's a
mhm,
lot of body image. There's a lot of, and then I feel like during menopause, perimenopause, women actually end up having the best sex of their lives, right? Because they stop caring about so much. They stop caring about, like, what other people think, and they start taking care of themselves, right? What is it that they want? What is it that they enjoy? And they feel more confident about telling people or their partners, whoever, what they like and what they want. And they're not
mhm.
willing to settle. And I feel that, in midlife, that there's so many things going on. So I can imagine that when women come to you for sexual health, it's not really just about sexual health. It's about all of the other things that go along with sexual health.
And I think it is easier said than done especially when you're having challenges with your partner, even with yourself, to say, be honest. It's easier said than done, right? It's easier said than done to say, hey, you need to tell your partner that you don't like what they're doing in the bedroom, that it doesn't give you any pleasure. You need to direct your partner as to what gives you pleasure. Even like, let's take it back from there. It's easier said than done to tell a patient, I want you to go and pleasure yourself. And while you're pleasuring yourself, find out what gives you the most pleasure. That's easier said than done. What allows somebody to actually do it is courage. So, what's going to give you courage to actually show up for yourself? What I hope gives a person courage to show up for themselves is the desire to live life to the fullest, because we aren't granted, we don't know the amount of time we're actually going to be granted. Like you said, if you get into menopause, that's a blessing, because that means you've been granted with time, you've been granted with life. And so I hope what gives women courage that I see is understanding that they deserve to use the time that they have here on earth to be happy, to have joy, and also to have some rest, to give themselves grace, because we have a lot of people in society and a lot of external things telling us what we should feel. We have a lot of external things telling us what sex should be, telling us what intimacy should be. You know, Personally, I'm in a stage with my husband where he's ill. He has a unfortunate diagnosis that has put him in a position where he can't perform physical tasks. And so we cannot have sex. And so, what does that mean for our sexual relationship? Does that mean that our sexual relationship should die? No, it definitely does not mean that, because there is that physical for sex, but there totally is this beautiful emotional and spiritual component to it also. And so, for that emotional and spiritual component, that's why I feel like that's a gift, right? From God, because it allows two beings to connect at a different plane. So that physical feels great. I'm not going to, we all know that, but that emotional and spiritual takes it to a different plane. And so if you can get there and give yourself all of those things that I was talking about, grace, rest, have some courage, then you can actually be on a different plane sexually, whether you're with a partner or not, because again, that level of satisfaction does not have to just be with a partner. It can also just be with self, because it really truly, like we were saying, comes for self. All of this is easier said than done, and all of this takes work. All of it. So yeah, you got the physical things that we do in the office. I do O shots. I do non-surgical vaginal rejuvenation. We do surgical vaginal rejuvenation, hormone therapy. We do systemic therapy for libido. We do all of those things. And after you receive those therapies, because your body is aging and your body may need those therapies, and after you receive those therapies, you got to do the work. You got to put the work in. So I do recognize that, because I'm also living it. I'm perimenopausal myself, so I'm living what I am preaching. I'm living I'm living the same way as my patients, and I recognize it's challenging. It's not easy, but it totally is worth it.
Yeah. Yeah. I love how you emphasize the work that we have to do on ourselves, right? I mean, it's easy to go ahead and tell somebody, these are the list of things you need to do, but it's really hard to work
Mhm,
on yourself. And, a lot of it has to come with maybe it's a lot of baggage that you carry. Maybe it's sex
mhm.
negativity that you grew up with. Maybe it's trauma. Maybe it's abuse. Maybe it's any one of those things, right? And so you have to really do the work so that you can live a healthy life. Do you think, what role do you think, like maybe stress or systemic injustice, plain sexual dysfunction, pain, or low libido? And how do you think we can start addressing it?
So chronic stress, chronic stress plays a huge role in all aspects of our lives. Just We talk about like the biochemical side of chronic stress and the free radicals that are released and how they're toxic to our body, they're toxic to our mind. So that's where I really emphasize rest, grace, and eating well. I think pelvic pain, we as women experience pain in so many different parts of our life. We experience menstrual pain, we experience pain during delivery. We experience if you have fibroids or other gynecological issues, you can experience pain from that. So we kind of we have kind of normalized pain, and so oftentimes for women that are having pain with sex, whether that pain with sex is because of atrophy, vaginal dryness, or you have an issue with your uterus, whatever the reason, pelvic floor dysfunction, whatever the reason, we normalize it and we continue, right? I always say that you will never see a man have bad sex. You just won't. If the sex is not good or their sex is not, there's a problem, he's having pain, able to have ejaculate, but it's like retrograde ejaculation because he has a prostate issue, whatever. He is going to go find somebody and ask. And then after he asks, that person does not give him the thing that's going to help him get better, he's going to find somebody else. He's going to keep on going. He's going to spend money. He's going to spend time. He's going to put the work in to get himself right. A woman will have bad sex, painful sex, sex that can cause her to tear up because it hurts so bad, will have tears because her vagina is so dry and not take this first step. And so, and I think a part of that component is all the other things we've talked about, but I really also think it's because we've normalized pain. We've normalized pelvic pain. We've normalized vaginal pain because we have felt it for many years in other parts of our lives. And so what can we do to change that? The biggest thing we can do to change that is to realize not all pain is good, not all pain, even if pain has an explanation, it doesn't mean that you have to feel it. And it doesn't mean that it's not tied to a problem that can be fixed. So that comes back again to just agency. I mean, I use that word a lot, but it always comes back to that. Like you have to have some expectations, right? You have to have some expectations of positive things happening for you. And so if you have those expectations, then you're going to demand that you receive those things, right? So I think a lot of it comes back to that.
I love the fact that you mentioned that women normalize pain. And I was just having that conversation with somebody else. I think I was on call and I was helping somebody deliver their baby. And she was like, she said to me, she's like, "Oh, I'm going to do everything naturally. I don't want an
Mm.
epidural. I just," so I told her, I said, "You're not going to get a medal at the end of this, right?
Yeah,
Like there's really no reason you need to suffer." I
yeah.
said, and I say this to patients all the time. I said, "Listen, I'm from Pakistan. Okay. And we have lay midwives there that go out into the field and deliver babies. And I get it. There's no epidurals there. The
Hmm.
women suffer.
Hmm.
They have pain. Sometimes they even hemorrhage to death, right?
Hmm.
Like that's something because of the location that they're in and whatever is available to them. All right.
Hmm. Hmm.
We are here in the United States of America at a hospital in New York. Okay. You have access to an epidural. You will not, God willing, hemorrhage to death. We will catch these
Exactly.
things. Um, you do not need to suffer. There is no need to suffer. And I said exactly what you said. I said, women suffer with their periods. Women suffer
Hmm.
with endometriosis. Women suffer with
Hmm.
fibroids. Women suffer in
Hmm.
labor and delivery. Women suffer post op. Women
Hmm.
suffer when they are breastfeeding. Women suffer when
Hmm.
they have sex with breastfeeding. Women suffer when they have going into perimenopause, there's decreased lubrication. Women suffer when they have lichen sclerosus, lichen planus, discriminative inflammatory vaginitis. I mean, women are so used to suffering. Women suffer when they have vaginismus. The vaginismus develops because they are having pain, and so now they have vaginismus. Women are so used to suffering. And it's like a part of their psyche. Like
Yep.
they're like, oh, I'm suffering. This must be
Yep.
normal because I'm suffering. that they don't know what it feels like to not suffer, you
Yep.
know? And it's almost like they invite it. Like,
Yep.
when labor and delivery specifically is what I'm talking about. When I say they invite, because there's no reason. Why do you need to suffer? Why do you need to suffer through those contractions? Just explain
Nope.
that to me.
And
Um,
and it's
yeah,
a lot of it is because we're told. We
yeah,
are told. Although you're right. Who at the end of the game end of the game has a medal for you? No one. But we're told you're doing this for your child. You're doing this because you're a woman. You're doing this and you're feeling this because of those things. And we have felt it for generations before. So it's your turn and feel it.
yeah,
Right? We're told, and that's a lie. I mean, if you don't want an epidural for whatever reason you don't want it, you don't have to have it. And at the same time, your labor can be an enjoyable experience, but you can't enjoy the process if the pain is there. That's just a fact, right? And so it doesn't mean that you did it any better. It doesn't mean that you did it any worse. It just means that you did it the way you wanted to do it without pain medication.
yeah,
And when you look back on that experience, what are the things that you want to remember? I think that's the biggest thing. How
yeah,
do we want to show up for ourselves? What do we want to remember? I want to remember the goodness. I want to remember, the look in my husband's eye while I was laboring and I was able to communicate and talk to him about how we're going to bring this child in, about the world that this what child is coming in, all those things. That's what you want to remember. You want to remember the experience. I want to remember as I am getting older with this, I have fibroids and I've done things to deal with my fibroids because they do cause pain.
yeah,
But I don't want to remember that every month for 7 days, I am just doubled over because these things are huge. No, I want to remember that during that week, my daughter had a volleyball championship that we went to, and I was able to be there and experience it and have fun with her. I want to remember that. So, how do I want to show up for myself? And whoever tells you, whoever makes you believe as a woman, to be a woman is to suffer. To be a woman is to suffer for your family, for your parents as they age, for your children as they grow. To be a woman is to have to lose self. That is a damn lie because you lose self, you lose life. You lose self, you're not there for the person that you love. You lose self, you lose experience. So, people say it all the time, self-care is not selfish. My thing is, I've said that a lot, but what I'm doing more now is I'm being selfish. If somebody else is not getting something because I have decided I'm going to take this opportunity to do something for myself, that's fine. That's
yeah,
fine. They'll be all right.
yeah,
They'll be all right. I'm gonna be selfish. There's
yeah,
too many years that I've spent caring for other people. So if I'm always caring for other people, what am I doing? Who's caring for me? Who's my best
100%.
advocate? I am. And
Mhm.
so if I need to be selfish to be happy, not saying selfish in that, I'm hurting people.
Yeah, of
If I
course.
need to be selfish to be happy and I have been a good person all my life, I'm going to be selfish. I'm going to be selfish and show up for myself. And so, yeah, in the labor room, show up for yourself because you know what? This is your day. You're giving birth to a child. You're going to celebrate this day as that child's birthday for the rest of their lives. But it's actually your day too because you did something amazing. So be there, enjoy it.
Right.
And as you know, if you get that epidural, you actually probably will deliver faster.
Yeah,
'Cause,
right?
and
'Cause
not as tense, right?
right, right.
But
You're able to
yeah,
relax. Yeah, no, absolutely. I think that I like the fact that you said it's time to be a little selfish, right? Not selfish in the sense that you take something away from somebody else and,
yeah.
for yourself, but in the sense that you're actually prioritizing yourself, your health. My mom actually says this to me all the time. She's like, "Listen, if you don't take care of yourself,
Hmm.
no one's going to take care of you, right?
Hmm.
You need
Hmm.
to prioritize your own health. You need to take care of yourself. You need to see when your body is talking to you, when it's telling you it's exhausted, you need to
Hmm.
listen and you need to step back, right? And I think that a lot of times we are in this race of life that we've constantly are comparing ourselves to other people and their lives and their races, and you're never going to win. Right?
Mm-mm.
Because you need to just focus on your own life and your own
Mhm.
race. And,
Mhm.
are you better than the day you were before? Are you,
Mhm.
did you make a difference? Are you getting one step closer to whatever your goals are? And I think that those are more important things than constantly comparing ourselves to other people.
Mhm.
Um, n-
Sadaf, you've worked hard, right? You
yeah.
do a lot of things. I'm always watching you on social media, the meetings, when you go to meetings, this podcast that you do, the patients you care for in hospital, outside hospital, and then you have a beautiful family. You have, so you do a lot of stuff. And if you don't take, and so this is me also preaching to the pastor, right? If you don't take the time to recalibrate as you get older, everything that you put out actually will be less than what you want it to be. It'll be
Mm,
less than what your level of ability is, and it will be less than you know um, it will be less than what you expect to give out, right? And so we have to recalibrate. We have to. And the recalibration is not like just one weekend a month away with girlfriends. No, the recalibration actually really needs to be daily. It needs to be daily because we wake up every day. So why would we not recalibrate every day? We take care of we go to work every day. So why would we not recalibrate every day? We take care of family members, friends, kids every day. Why would we not recalibrate every day? So there really has to be a moment every day where we just breathe life back into ourselves. And that could be sleep. That could be reading a book. That could be when my kids were younger, I would go hide in my closet because they couldn't see me. Because the closet, the bathroom door is open. So if the bathroom door was open, they see the bathroom open, my closet's in the bathroom, then they wouldn't know I was in the closet. I was hiding from them and I was recalibrating and they were fine. And so with this practice, opening up this practice, I've had to actually relearn that because there will be times in life where girl, I'm taking care of myself. I'm at the gym 6:13 in the morning. I'm doing that. And then something will happen. It can throw you off. It's called life. And then you may get off track, but you can get right back on. You can handle your business and then come back and make sure you're doing those daily times of recalibration so that you can show up. You can actually show up as the fullness of who you are, and what you're putting at is at the level that you yourself are personally happy with the work you're putting out, so that you're not becoming less and less of yourself and putting out less and less of what you want to in the world. So anyway, all that to say, there will be times where you just can't, and that's okay. You give yourself grace, you work through it, but then come back and show back up for yourself.
I love that. I love that. I love that. I love that advice. I am going to take it to heart. And, I agree with you. I think that oftentimes, we end up working late, whether it's on social media, whether it's on podcasts, whether
Hmm.
it's whatever, and we don't give ourselves time. So, actually, what I do that is my time is I love working out, but I also I like taking walks in the evening with my kids,
Mm.
and we do that, especially in the summertime. Wintertime it's a little bit
Hmm.
harder, but in the summertime we love to, go for a walk in our neighborhood, and it's really nice because there aren't
Hmm.
that many people out, and you just enjoy that time together.
Hmm.
Sometimes we'll go for
Get to
ice cream.
talk.
Yeah, yeah,
Yeah,
absolutely, and
yeah,
we'll go for frozen ice cream or something like that. So yeah.
yeah. And when they see us easy like that, they give us more of themselves. I've noticed that with my daughter more also, where sometimes I'm trying to pull words out of her and she's not pulling, she's not giving. But when I'm a little bit just like, I'm easier with her, and it's just, oh, let's go to the store and peruse, or she loves to draw. Let's just get some paper out and draw. And then that's when the words start coming out. That's when I get to really see who she is and understand what she's experiencing, and it's beautiful. But what I have to do that is I got to, pull back a little bit from other areas. So it's important. That's good. I'm glad that y'all do that.
So just some fun questions now. What do you think is the most underrated organ in the female body?
Oh, hands down, the clitoris. I mean,
Yeah.
I think we talk about it a lot now.
Now we do. Now we
Yeah.
do. I
Now
didn't
we
even know what
do.
it was. Did you know what it was when you were in residency? I was never taught. I
No,
don't
oh,
think I was.
residency, no, no,
You're right.
no, 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 no. I knew forceps.
Yeah.
I knew how to do that. I knew,
Right, I knew the
but
uterus, right? I knew the
yeah,
uterus.
yes. But the amazing organ of the clitoris, especially, I think we talk about it a lot more now, but I still don't think it gets its enough attention when we talk about when people are thinking about pleasure. Because there's a lot of, like, we talk about caressing, we talk about kissing, we do talk about lubrication. Um, Oftentimes patients that I have, they're really concerned about nipple sensitivity. They're concerned about, squirting. They're concerned about penetration and receiving orgasms through penetration. And then I always ask about the clitoris and attention to clitoris and what's happening to their clitoris and during sex. And that part of the conversation is, oh yeah, maybe, but during foreplay, there's not enough attention played there. So I still think it is the clitoris. A lot of women don't look at their clitorises. What I
Yeah.
have
No, they don't.
noticed throughout this time of having this practice and myself, because again, coming back to it, we in residency are not taught to do clitoral exams.
Not at all.
What I've noticed as I do continue to do more clitoral exams is there are a lot of just adhesions to the
Tons,
clitoris.
tons.
And so when I'm talking to patients and showing them, it's something that they didn't even recognize, right? And so then we're talking about how hygiene to the clitoris, how you
Yes,
pull the clitoral hood back and you clean
yes,
underneath it, all
yes.
of those things. So I think, yes, it is to me the most underrated organ. We just in the last how many years have really understood the entire anatomy of the clitoris.
Yeah.
But honey, it's the most important. That clitoris needs attention.
So sex in midlife, better, worse, or different?
It's different. It's different, and that's okay. It's um it's better in many places. Intimacy is amazing. That closeness is amazing. Sexual connection and energy is amazing. Physically, it doesn't always feel as great as it did earlier, right? And that's because of just changes. But
Yeah.
there are ways you can augment those changes. You can change the changes. There's ways you can compensate for the changes. You got to bring some tools into the bedroom and be okay with it. Pleasure tools. Bring some sex toys. Use them while you're with your partner. It will heighten, it will help. It will make it can make it even better than it was before. You got to use lube and you got to use the right lube. You can't just spit is not lube. You can't just
Spit is not lube.
and people do it. And I just think, okay, but there's stuff that's better, you know.
Yeah. Something that won't dry out. Yeah.
And it won't dry. Yeah, it actually will help you and make it feel even better. But you got to bring that into the equation. And even if you're like, I don't know what this thing is, with a lot of my patients, they'll say, I have enough lubrication. I don't need lube. Well, use it anyway. I mean, you don't have to say you need it to use it, and you don't have to say you need it to make it feel better. The wetter, the better.
Yeah. Yeah.
So it's different. Sex midlife is definitely different. And you may need to put in a little bit more work. You may need to use some more tools, and that's okay because that's what you need.
I love how you said sex. Spit is not lube. I love that.
Yeah.
I'm going to remember that. Okay. So finish the last question. Finish this sentence for me. A sexually empowered woman is.
Honest.
I love
She's
it.
honest. She's honest with self. She is honest with her partner.
Yeah. Yeah, love it. Love it. Well, thank you so much for coming on. And for all of those people that are sitting there watching and listening to you and thinking, wow, she is amazing. She really gets it. I want to go see her. Tell them how they can find you, how they can book an appointment with you, and what your social media handle is.
So you can find us on all socials at Hello Climax. That's HELLOCLIMAX. Our website is helloclimax.com. You can email us at info@helloclimax.com. We are located in Virginia Beach, Virginia, but we do see patients in New York and also in Maryland. Our phone number is 757-916-5348. And I would love to talk and love to hear from anyone who needs help with their sexual life or just wants a little bit more information.
Amazing. Well, we really appreciate your work and everything that you do for women's pleasure and women's health and sexual health. That is definitely something that we don't talk enough about. And I think that's something that not many physicians feel comfortable doing. So I think it's fantastic that you feel comfortable, and that is kind of your whole practice is pleasure, which is fantastic. So I love it. So thank you so much for coming on. And well, we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.